When you're in a smaller area, having a physician's practice usually is a busy practice. But when you start getting out into the specialty, there's not enough business to put somebody in to keep them busy full time. A psychiatrist is kind of in that same kind of situation where if they came here they would be busy, but not busy enough to have a real thriving practice. Having telehealth, we have multiple psychiatrists provided through the South Carolina Department of Mental Health who, when we call them, they're doing something else, they're taking care of other patients, but then they can give us their time when we need it, which maybe is 3 or 4 times a month in an emergency room, and you could not provide a psychiatrist here full time to see 3 or 4 crisis patients a month. You bring it into the room and the patient's looking directly at that camera so the psychiatrist can see them, but then they can see the psychiatrist that they're talking to. And it's really that simple. We're a critical access hospital, which by definition means we're going to have 25 or less beds. We did not have an employed psychiatrist. We have one contracted that helps us with our program 6 hours a week. Here we have 24/7. We bring in our cart, we reach out to the psychiatrist on the other end, and they can interact with the patient right through telehealth. The wait time is just so important to reduce that by every second. They need help now, and they can't, and they get worse and worse as the days go by. I read a couple of weeks ago that there's about 1,450 critical access hospitals in the country, and 1,316 of them lost money last year. So we're all right on the edge and trying to survive in a market that is constantly being scrutinized and finances being reduced. South Carolina Department of Health and other programs really is what makes us able to do it. We may not have done this had it not been for that help.